Good afternoon, and I'm your host, Don Burgess. Welcome to Burnews News and Views. And today we are lucky enough to have the Premier, the Honorable David Burt. Welcome, Mr. Premier.
Hey, good afternoon to you, Don, and good afternoon, Bermuda.
So we want to start off with something light. How was your vacation?
The vacation was lovely. Not as much vacation as I would have liked, as ministers have to certainly keep in touch with what is going on in Bermuda while we're away. But we decided to take an extended vacation, knowing that our children would return to school because Ed and Mia had not seen some of their cousins, and my wife, Kristen, of course, is from California, and she has not seen most of her family in 2 years. So it was important for us to get away, for them, my wife, to reconnect with her family, and for our children to, I guess, meet their cousins, play with their cousins. Some of them, the last time we were there at Christmas, were too young to play with. There's new cousins that they never met before. And as we all know, that Christmas is for the children. So that was, the best part of the vacation. And it was just gratifying to see them, playing with their cousins, as you kind of remember and reminisce of your time when you were young and you got to meet your cousins and have fun at Christmas. So it was a wonderful and enjoyable experience. And now we are back and ready to get fully back into work.
Okay, awesome. That's what the people want to hear. Just to go over the format today for our viewers, we took questions earlier today on Burn News, so we have a lot of reader questions. We'll try to get through as many as we can, and then if we have time, we'll go to some that are posted in the comments. And a lot of the questions, Premier, have to deal with COVID, so I don't know how up to date you are on that, but we'll start rolling with them. What has government done with the lateral flow tests international business gifted to government? For example, Partner Re donated 45K.
What I can say is that I am certainly up to date. As I said, Don, we have been, all ministers have certainly been keeping in touch with their portfolios while they're away. We did have a cabinet committee meeting earlier today to discuss matters related to the coronavirus. In regards to the tests which were donated, those tests have been put to use in various places. And what we are going to see, recognizing the backlog at MDL with the processing of PCR tests, is that we're going to see those deployed for use in our public school system this week. They were always intended to be used to keep children in school. That was the basis of the donation, recognizing that the business community wanted to work with the government to ensure that we could keep students in school and reduce the amount of mass absences and school closures. And from the perspective of the government of Bermuda, we made a decision, and I think that most parents would agree with the decision, that the best place for our students to be is in-person learning. I have two young children as well, and I recognize the emotional anguish that takes place when they are not in school. I recognize the challenges and inconveniences of remote learning, and recognize that it is nowhere near as effective as in-person learning. And so we want to make sure that we have children in school and keep children in school. Those tests will be used to do just that.
Now, just as a follow-up to that, so are all schools going to be tested this week? Or are they going to have the regular schedule, or will most of the schools or some of the schools go back to the weekly testing?
I can say that I don't have the specifics on that. I know that there was a discussion in the meeting that was held earlier today, and I know that those matters will be relayed to the public. But what we want to do is to make sure that we put those tests to use, as it is important that we keep our students in school, and we make sure that we are providing a safe environment for them to remain in school. But what I can tell is parents is that one thing that you will see from the government of Bermuda is that you will see that there will be a more strict checking for symptoms upon the entry to classrooms or the entry to school, and students who cannot pass the entry questionnaire and are exhibiting outward signs and symptoms of possibly being sick, given that the Omicron variant is incredibly transmissible, that those persons will be asked to not come to school and to return home. And I want parents to make sure that they can cooperate with the government and with the Department of Education to ensure that if your students are exhibiting symptoms, that you do not try to take them to school.
Okay. To somewhat follow up on that, with another reader question, or second one here. Why wasn't Dr. Karika Weldon given the resources she requested, and why isn't more being done to ensure that her guidance is being followed and perhaps even convince her to return?
I will just speak in a broad measure in regards to Dr. Weldon. The first thing is that I was responsible for bringing Dr. Weldon to Bermuda. I remember sending her a WhatsApp message and describing the challenges which we had. And it was an incredible amount of work that has been done by Dr. Weldon, but all of the public health teams throughout this pandemic. The question says advice which was given. The government of Bermuda and the ministers are charged with policy decisions, not public servants. And it was the determination of the government of Bermuda, which I think is supported widely by parents across this country, is that the best place for students to be is in school learning in classrooms. There was a difference of opinion. I understand, recognize, and accept that. But the government of Bermuda has to balance all of the challenges there. And we recognize that there was some inconvenience with the delayed and staggered return to school, but I think that that would pale in the comparison to some of the recommendations that were given to start school remotely for 2 or 3 weeks. I do not believe that that would have been the proper course of action. And here we are today on Monday, where all of our preschools are open, all of our primary schools, save for one, are open, and all of our middle schools, save for one, are open. Our high schools are on remote learning, and there will be interruptions as we go forward. But what we want to do is to keep faith with what we promise the parents of this country, is that we are going to do what we can to ensure that there is a safe environment in schools for our students, and we know that they learn better. It is better for their emotional and mental health and their development to be in school learning.
Okay. Next reader question is, what steps or solutions are government considering for closing the staffing gap for testing?
We speak about the staffing gap, and I was brought up to date on this. There was a request that came into to the government for additional staff last week Monday, and it was approved on the same day last week Monday. Certainly, it does take time to onboard persons, but the approvals were given on the same day which were received, and I know that additional staff have started working in the laboratory already. It certainly is a challenge when we have these types of spikes and backups. That much is accepted, and I want to certainly apologize to persons who were certainly inconvenienced. I recognize that there were persons who had travel plans changed, but I also want to pay homage to the public officers who responded quickly, who implemented alternative plans, who put in place overnight antigen testing at the airport to address the issues which we face there, and to stand up additional places. But I think what's most important is, on long term, we talk about the staffing gap. We have to move to a place of sustainability when it comes to the coronavirus response. And so I understand that the Bermuda Health Council will be issuing directions today to doctors' offices, to pharmacists, to dental offices, to enable them to be able to administer supervised antigen testing throughout the country. The testing backlog can't just be on the government. If we're going to move ourselves to a place of living with the coronavirus, there needs to be multiple spaces for access to testing throughout the country, and we're going to make sure that that is happens. And I would urge persons to encourage their doctor's offices, their family doctor's offices, and certainly I know that there'll be pharmacists that will be on board to assist in this regard, and I think that that will certainly help the situation as well.
Next reader question is, mandating vaccination for individuals being considered? Other jurisdictions, such as the US and UK, have mandated vaccines for healthcare workers, first responders, teachers, etc. Is this being considered at all?
As we have stated on numerous occasions, we believe that vaccinations are a personal choice. I believe that that is a decision that is best to be held between an individual and their doctor. And what the advice which the government of Bermuda has said, and which the government of Bermuda will repeat, is that a person should have a conversation with their doctor and make the decision which they feel is best for them.
Okay, just as a follow-up to that, I know like the hospitals requiring Bermuda Hospital Board is requiring all people on work permits to have the vaccine. So are other government positions going to be requiring people to have the vaccine as well, sort of as a health requirement like the TB test?
Those are conversations that I'll leave to the Minister of Labor to address. What I can state is that there's a technical matter there, and the technical matter is that if an individual, because remember, employers have the responsibility to repatriate persons after their work permit expires. And if someone's work permit expires and they're not able to travel due to the fact that they're not vaccinated, that means that they will remain in the country indefinitely. So I believe that is the basis of that decision, which may have been made by the Bermuda Hospitals Board, and that may have been done based upon experience. And that would be something that would be a contractual relationship between the hospital and their employees.
Okay. When will they roll out vaccination for 5 to 11-year-olds?
Excellent question, because I know that were able to get their first dose when they were away, and hopefully we'll be able to get their second dose here. In the meeting that we had earlier in the day, the COVID committee meeting, the Minister of Health said that the local advisory committee on vaccines is looking at those recommendations, and we should expect an announcement on that. I would say next week. It's certainly something which we wish to offer for those parents who wish to have their children immunized. But again, it is the choice of the parents in consultation with their pediatrician.
Next question from the readers when can we expect to see reduced isolation/quarantine periods like in the US and UK? And will there be different rules for vaccinated whereby you just test out of isolation if a close contact?
I think there are already different rules for vaccinated persons in Bermuda, but in the broader question of the reduction of the quarantine period, that is going to be done on the basis of data. Of course, in the Bermuda context, it's a lot more difficult to gather data as they do as rapidly in other jurisdictions. But I think there was a statement from the government over the weekend which said that they're examining that, and inside of the meeting in which we held earlier today, there was the report that is currently being examined. We should look forward to announcements on that, whether this week, but no later than next week. Because I think that it's important, Don, as I've said on numerous times, and I think that it's important for the country to understand the perspective of the government of Bermuda. Public health regulations are not there for population control. They're not there for any other reason, with the exception of ensuring that our hospital does not become overwhelmed. We understand and recognize, and we have lived through that. We have lived through what happens when a hospital closes down, can only accept coronavirus patients, emergency patients, or people with cancer treatments, with people who require surgeries are not able to have those surgeries being done or delayed. It affects the health of our entire population, and that is what our public health regulations are designed to do. So we will look to see what happens. We're certainly going to compare the trajectory of previous waves based on hospitalization to what we have now. But we also have to recognize that over 70% of our population has been vaccinated. We have one of the most successful booster programs in the world, where half the persons who have been vaccinated have received their booster, or more than half the persons who are vaccinated have received their booster. And we also have to recognize that there is also I would say, resistance in the country that is based upon infections, prior infections, where we saw a significant amount of people infected during the Delta wave. And so the expectation is that the pressure on the hospital will be less this time around than it was before. But we need to take a careful approach, because what we don't want to do is to get to a space where we find ourselves trying to chase and having to take more drastic measures later down the road. So we want to make sure we put in place proportional measures that happen earlier, recognizing what the Omicron variant and the spread will happen. But we will have record cases. We will certainly have individuals who are going to be out sick, that is going to test public services. But I have no doubt that we will persevere through this particular wave as we've done in previous waves. And I think that we're in a better position now than we've been previously, due to the level of vaccination and also infection-based immunity, which we'll find inside of Bermuda.
Just to follow that up, based on projections and things, I know, like when we had the Delta wave, we had the curfew instituted mainly to prevent accidents overnight. Because this hospital staff was already overworked with both the hospital and the ICU. But this time we've instituted a curfew, and at that point in time, there was just one person in the hospital. Why was a curfew necessary?
So let me just look at the broader context of where we have and what the government was doing. And I think if you would recall in a press conference that we had in December, is that we were looking at publishing a broad-based metrics insofar as what would happen, what would be the various levers or places where we would need to meet in order to enact restrictions. And so we had, the base level, the next level, the following level, and then the worst level where public health systems are overwhelmed. But I think what's important is that you learn from past experience. And I think if there's anything that the Alpha wave last April and also the Delta wave last October is that early action. And every time we have approached a new variant with the same approach as the last variant. And that's when you have a more transmissible variant, that has always not worked out the best. So in this time, we said, let us go one step further to make sure that we are even going ahead, because the last thing we want to do is we do a small level of restrictions, and then we have to be even more harsher for longer in the period. These were restrictions put in place for 4 weeks. They will be reviewed next week, and they're going to be reviewed from the lens that we need to not worry so much about infection numbers. What we need, because people are going to get infected with the Omicron variant. It is going to happen, Don, and that is going to be it. We are going to, undoubtedly, like every other country in the world, report record cases. But the real concern is what is taking place at the hospital. And if we have a stable situation at the hospital, then we can look at making certain changes.
Okay. Next reader question. When will they get rid of the TA for residents? Because it's ridiculous at this point.
I do not believe that travel authorization will go out of use until the earliest, I would say April 1st, 2023. And so that is the timeline for the travel authorization. But what I can state is that I know that there are a number of concerns that people may have with the travel authorization. I know that these were discussions which we're having in December of simplifying the process, enabling families to put various things together, make it simpler, and possibly even looking at transferring these particular items into an app. Those are all work streams in progress, because we recognize that from a competitive perspective, we want to make Bermuda an easier place for our visitors to visit. And so from that, and wearing one of my hats as the Minister responsible for tourism, I recognize that Bermuda is not as competitive as we need to be inside the tourism space. And so the conversation discussions that are taking place are, how can we look to reduce the restrictions at the border and adopt the position of living with the coronavirus. And I think that's important. So what you will see is that you will see changes to border policies that will make Bermuda more, I would say, competitive. And what you will see is that there's going to be an increasing level of, I guess, personal responsibility that are going to be put on members of the public. I mean, if you're going to put yourself into a risky situation, you just have to understand what that situation may mean to you and your family, especially if you do not have any resistance to the infection, if you have underlying healthcare conditions, if you haven't been vaccinated, and other things. But from that perspective, the travel authorization, I would not, I personally should not expect that the travel authorization will not exist until April 1st, 2023. It's not this year. It's in 16 months at the earliest.
Okay, another travel authorization question from our readers. Can the TA become one form per family instead of all separate forms for separate individuals? And also, can the fee be cost of $75 at least for children and seniors? Can the TA have an app like Verify instead, which is what the airlines are using right now?
I would say that your readers are certainly reading our mind. So I think I kind of answered the question about one per family, and that's some of the things, the comments and feedback which have come from, I would say, the stakeholders of Bermuda Tourism Authority and the Hotel Association in regards to that. in regards to the reduction of fees for the travel authorization itself, seniors, and also young persons. I do believe that there were differential fees that existed before. I'm not sure if there is one for seniors, but I certainly think that that's certainly something that we can consider. But the government is going to be announcing by the end of the month what our strategy is going to be for the upcoming fiscal year that begins April 1st, is we have to reduce the amount of, I would say, energy, effort, time, and public money that is spent on our coronavirus response. And it's necessary for the country to adjust for the long term, because we are not going to be able to maintain this level of defenses for the foreseeable future, and recognize the coronavirus will be with us for some time.
Okay. I'm going to try to do rapid fire for these questions.
And I'll try to answer shorter.
Okay. All right. So, seeing that every person is tested upon arrival, would Bermuda government consider, like the UK, and discontinue residents from requiring a pre-arrival test? If not, what is the logical reason, seeing that the arrival test is picking up what the pre-test continues to miss?
So a couple of things there. What I would say is that yes, the government is looking and reviewing all of our travel policies. As I said in this interview before, these were processes that started in December, which I had spoken about when we had our press conference in December, that we're reviewing for the upcoming tourism season. I would guess the purpose of our pretest is to ensure that we don't have positive people that are boarding planes, certainly who may be infectious. And so from that perspective, all of those particular items are being reviewed in the space of appropriateness and also in the space of competitiveness.
Okay. Why are we still using SafeKey? With all the delays, most become useless and businesses are suffering.
SafeKey has been demonstrated in previous outbreaks to be a good protection and a way to minimize the risk of transmission. But all things have to be reconsidered in the space of the Omicron variant, where persons who get SafeKeys for vaccine-based SafeKeys who get them renewed every month, the differential between those persons with transmissibility may be significantly reduced. So those are all things which are certainly being considered in light of the emergent science of the Omicron variant. One thing I know that is coming up is the SafeKey renewal, which is happening, and the decision which was taken by the government of Bermuda in, I want to say, December, to ensure that vaccine-based SafeKeys would be automatically rolled over for individuals who vaccine-based SafeKeys automatically rolled over for individuals who were boosted. But for persons who did not have the boosted, they would have to test. Clearly, with the testing capacity that is limited currently, we're re-examining that. And the final decision will be made at the cabinet tomorrow and will be communicated by the Minister of Health to the country on Wednesday.
Okay, the next question you've sort of addressed already. Can you address the constant use of the curfew and how that has failed to stop the spread? Cases are over 1,000. The curfew has done nothing to slow that down.
I think I've addressed that question. So I don't want to take too much of your time.
Okay, so the next one, why can't public school students and teachers use the same or use the at-home antigen test twice a week instead of going to get a PCR test with results taking up to 3 or 4 days to receive?
I mean, the PCR testing plan was rolled out, I want to say, to all stakeholders on December 13th last year. And the pressures, part of the changes were to make sure that the system did not get overwhelmed, so be able to deliver the return to school testing. Clearly, with the amount of persons that were traveling over the holiday, the amounts of visitors who were coming in, and the significant level of positives certainly backed up the testing system. But in response to the question, the antigen tests that were donated by the public will be put to use for that, not by the public, by the business sector, will be put to use for that exact same purpose in the public schools. And I would ask parents to make sure that they are cooperating with the Ministry of Education in this regard to make sure we keep our schools safe.
Okay, our last COVID question before we move on to other things. Is it lawful to mandate weekly PCR testing at a job site 2 times a week by an employer that the employee must pay for?
That would probably be a question that we more appropriately address the Ministry of Labor, but I would say on a broad basis is that an employee-employer relationship is governed by their employment contract. And so I think that an individual should certainly seek legal advice, and if they have a question on that, they should certainly contact the Ministry of Labor, who will be able to provide them the correct legal advice on that. I don't want to answer questions that I don't know.
Okay, thank you. How do you think this year's tourism season is likely to be?
This year's tourism season will be a challenging one, but I think that it is in the space of the government of Bermuda to make sure that we make the changes which are necessary to our border requirements to make sure that Bermuda is more competitive. And I can see a place where, as was addressed earlier, that there may not be pre-tests or there may not be arrival tests and just pre-tests are required. They may not be testing on island. All of those things are currently being considered. Of course, Bermuda right now is for tourists, is only available for vaccinated tourists. And we have to remember that the aim of our public health measures is to reduce the risk of overwhelming the hospital. As vaccinated persons are far less likely to end up in hospital, I believe that we can make adjustments there that are in line with our public health measures to reduce that risk. And I do believe that if we make the appropriate changes, that we can see a successful tourism season. Our internal figures in the government of Bermuda is we're targeting a 50% of what we had in 2019. That will be difficult to achieve with the Fairmont Southampton not being open. However, that is the target at which we're set, and we're going to make sure that our policies are in place to reflect, to make sure that we can have a successful tourism season.
Okay. Oh, next question. With Omicron raging, school opening, closing, opening, the economy tanking, bus service canceled daily, gun violence at a very high level, why did you take a vacation? Do you understand that part of the job as premier is to lead in times of trouble?
I am fully aware that my job is to lead in times of trouble. And I'm also fully aware that I have a cabinet that is able to support each other and to make sure that we assist in times of need. As I had indicated, all ministers that were on vacation are in constant contact with ministers that are working in their stead under the Constitution, as is required. If a minister leaves the island, an acting minister needs to be appointed. But oftentimes when ministers are traveling, they're continuing to do their work. This is the nature of a hyper connected society in which they live. I indicated the reasons why our family went on vacation. Every other year, we go to Christmas in California, so my wife can be with her family, and that our children can be with their family in California. And so I understand that some persons may not appreciate that, but what is important for myself and what is important for others is to recognize that ministers, premiers are humans too. We certainly need time to recharge. And if we don't recharge, we will not do the best work for the people of this country. I've seen how hard my ministers have worked, and I encourage them to take a break. And most of them didn't get the break at which they wanted, just like I didn't get the break at which I wanted, due to the fact of the challenges of which we're being faced here. But by and large, I'm proud of how the public service was able to respond. I'll give you 5 more minutes, Don. Keep going.
Okay, great. So just to follow that one up, oh, never mind. What's the, yes or no?
Go on.
Okay, all right. Just, isn't it a bit archaic that we're having acting ministers, considering when the time the law was written for those? And like when Joe Biden goes on vacation, Kamala Harris doesn't become acting president of the United States. Is it something that needs to be looked at?
Certainly, I think that that's a very fair comment when we speak about issues of constitutional reform. I mean, we're talking about simple and small changes, the ability for there to be more flexibility in acting ministers and acting ministerial appointments, et cetera. So yeah, I mean, those are things that I will certainly accept, that those are things were written in a time in 1968. So, but what I can state is that, as I said before, that ministers were in constant touch with the activities which were taking place.
Okay. Next question. What's the holdup or timeline for introducing the minimum wage?
I certainly welcome you to have a news and views session with the Minister of Labor on this. The Minister of Labor has been working diligently, but the issue of the minimum wage must follow the law, which was passed, and we're waiting for a further report from the Wage Commission, which is examining the items before they make an official recommendation to the Cabinet, of which we can take to the House of Assembly to make sure that minimum wage is established.
Right. Next, another timeline question. What's the timeline for introducing unemployment insurance?
Unemployment insurance is certainly going to be a longer term issue. I don't want to place a timeline on it at this point in time. I do know that it was inside of our election manifesto, which means that we have to deliver it before we go back to the polls.
All right. What are the constitutional changes that you want to see this year or the rest of your term?
I do believe that the questions will be best addressed to the Attorney General as she's leading on that. And so I don't want to preempt that. But as I said, they're just simple changes, which you see, some of which you had mentioned in this earlier, in this interview earlier. Others are small things in regards to how appointments are handled on various bases. So the fact is that our Constitution hasn't had significant upgrades since it has come into effect. And as you said, the world is a different place. So from that particular case and aspect, I think it's important. And I think it's also important that spaces where the government is certainly serving an advisory role to the governor in some places may be able to be amended as well.
Okay, one last question before we go. We keep hearing casino gambling keeps getting pushed down the road. You know, last year we were told that it was going to be by December, and now we're told another 6 months. When is this actually going to happen?
I will answer your question this way, Don. And what is important for all of Bermuda to recognize is that Bermuda is a well-regarded international financial services jurisdiction. And what is important is to recognize that the government of Bermuda does not have control of the issuance of casino licenses. That is delegated specifically to the Bermuda Gaming Commission. You're welcome to have an interview with them to speak about the work of which they're doing. As the Minister responsible for gaming, I am confident that the Bermuda Gaming Commission is doing everything which they can to accelerate the timelines to ensure that we can open casinos in Bermuda in the shortest fashion. There's been a significant amount of work that has had to be done in the background, in the foreground, in order for this to happen. But we remain confident, and it is not a question of willingness. It is a question of lots of different moving parts regarding the banking of casino proceeds, in regards to the issuing of licenses that have to follow those particular processes. So I don't have the latest update, but what I can say is that we continue to work with all partners to advance as soon as possible, as I recognize, as other people recognize, that this is an amenity to our tourism product, and it's also a job creator.
Okay, well, thank you for your time today. Is there any last words that you want to say to the public?
What I would say is that I'm grateful, certainly, to be back to work. There is certainly a significant amount of energy that has been expended by the teams over this holiday period. And I just want to pay homage to all of our public sector workers who worked through the holiday under incredibly difficult circumstances to continue delivering public services. I want to make a special shout out to our teachers for the work of which they are doing to, while providing a safe environment for our students in school. And it is certainly tough, but as a country, we have to learn to live with the coronavirus. The Omicron variant will be a challenge. We will report record cases. There will be significant disruptions, but as long as we remain focused on what is necessary, the government will make sure to keep an eye on the hospital and will make the appropriate choices and decisions. And what I hope is that in this year of 2022, that we can continue with a sense of unity, a sense of togetherness, and a sense of recognizing that the coronavirus will not defeat us if we are able to work together to make sure that we can get past this hurdle. So I'm looking forward to a year where we can actually deliver on the mantra which I've always stated about moving beyond the pandemic. And I believe that we are ideally positioned and poised in which to do so. So I wish all of Bermuda a happy new year and look forward to continue the work.
All right. Thank you, Premier Burt, for being with us.
Thank you very much, Don. Good to see you.
And on behalf of Bird News, I've been your host, Don Burgess. And since this is our first show of 2022, hoping everyone has a Bermudaful 2022.